The American Medical Association's goal is to promote the art and science of medicine and the betterment of public health. In 1847, Nathan Smith Davis founded the AMA, and during the same year, the interest group founded the Academy of Natural Sciences in Philadelphia, as well as establishing standards for preliminary medical education. In the following year, they recommended the amount of anesthetic in medicine and surgery be determined, that the state governments register births, deaths, and marriages. The AMA Committee on Ethics was established in 1858. The Journal of American Medical Association was founded by the AMA in 1883. In 1813, the AMA established a propaganda department to gather information concerning health fraud and quackery. They adopted standards for medical specialty training in 1923. In 1946, they started making broadcasts on TV that brought health messages to the public. The recommendation that the AMA made was that all cars have seatbelts. In 1956, alcoholism was declared an illness. 9 years later, they adopted a report on the dangers of smoking. They then launched a war on smoking, which encouraged the government to reduce and control tobacco use. They hoped for a smoke-free society by 2000, but as you can see, this did not happen. In 1991, they began a campaign against violence within families. On 9/11, the AMA sent 3,500 volunteer doctors to help the citizens impacted by this tragedy. Soon after the AMA was established, they created the Journal of the American Medical Association, which publishes current events in the medical community. In January 2015, the AMA and a coalition of several health care organizations have filed a Friend of the Court brief urging the U.S. Supreme Court to allow private actions challenging states that break trust with the Medicaid's promise to provide patients with equal access to health care. This thus brought up the issue that people on Medicaid were not receiving the same rights as those with private insurance. Medicaid is supposed to support equal access to those who need it, but unfortunately, the states have control over it. And in 2012, it is reported that 32 states froze or reduced Medicaid, and in 2013, that number only reduced to 23 states. Another issue the AMA is working to combat is obesity. In June 2013, the organization recognized that obesity is an illness that warrants far more attention than physicians, patients, and insurers currently give it. Their goal was to ensure doctors were more aggressive when treating people with obesity and to stop the prediction made by experts that in 2040, half of adults would be obese. Another issue on the AMA's agenda is insurance merging. The AMA says the merger of Anthem and Insignia and Aetna and Humana would reduce competition. Critics are saying this merger affects competition to Medicare beneficiaries because it would reduce options in the market for private Medicare Advantage plans. There are, of course, many more events the AMA are working on daily. The future of the AMA is going to continue to grow because medicine will always be